For the results and conclusion, in both control and study groups, most of the subjects were categorized within the normalization criteria of BMI, and a p-value of 0.39 was obtained, showing no significant correlation between the BMI and GTM. For the cups of rice per meal and GTM, a p-value of 0.71 was obtained, which means that a correlation between the number of cups of rice per meal and developing GTM was not established. However, a significant correlation was observed between the previous history of GTM and having GTM in the present pregnancy. With a p-value of 0.002, this indicates that the history of GTM is a risk factor in developing GTM on the next pregnancy. Linear regression analysis was done to show the correlation between the serum and salivary glucose. An upward linear regression was obtained, indicating that the values of serum and salivary glucose are directly proportional. A significant correlation between the two parameters was observed with a p-value of 0.00, correlation coefficient of 0.94, and r-squared of 0.90. These estimations are very close to the actual serum glucose values of the subjects. The correlation coefficient of 0.94 shows that the salivary glucose is capable of estimating 94% of the serum glucose level. For the salivary glucose threshold level, a regression equation was derived using this formula and was converted to blood glucose and vice versa. A threshold value was determined that any value between 92 to 127 mg per deciliter of salivary glucose, the patient is considered having GTM. Using these cutoff values, based on the salivary glucose level from the total number of participants, 13 of them were true positive, 26 were true negative, 1 false positive, and 0 false negative was obtained. We observe one false positive result with salivary glucose, and this may be due to the risk classification of the subject, which was categorized as high-risk patient, and a further test is recommended. To evaluate the diagnostic accuracy and sensitivity, specificity, positive predictive value, and negative predictive value, we computed them using this formula, and we obtained a sensitivity of 100%, specificity of 96.30, positive predictive value of 90.86, and negative predictive value of 100%.